Transgender woman refused medical care, then Oprah steps in to save the day. How will this story turn out? To find out, watch the video to the end. But first, please subscribe to my channel and turn on notifications to get more stories like this. In a bustling city known for its diversity, Evelyn Hart, a transgender woman in her mid-30s, stood outside the imposing facade of a renowned medical center. Clad in a vibrant blue dress that accentuated her graceful figure, Evelyn exuded confidence despite the churning storm of apprehension within her. She had been dealing with a persistent health issue for months and had finally decided to seek specialized care. However, as she entered the clinic, she had no inkling of the storm that awaited her inside. The waiting room was pristine and clinical, with patients of various backgrounds seated anxiously, flipping through outdated magazines. Evelyn approached the reception desk, where a young woman in scrubs barely looked up from her computer screen. "How can I help you?" the receptionist asked, her tone clipped and indifferent. "I'm here for my appointment with Dr. Clayton," Evelyn replied, her voice steady. The receptionist glanced up, her eyes scanning Evelyn's appearance before flickering to the screen. A momentary flicker of judgment crossed her face, almost imperceptible, but Evelyn caught it. "I see," the receptionist said flatly. "Please take a seat. We'll call you when the doctor is ready." Evelyn nodded and found a chair near the corner, attempting to ignore the stares from a couple across the room. She busied herself with her phone, trying to drown out the unease that had begun to creep in. Minutes turned into an hour, and patients who arrived after her were called in, one by one. Finally, her name was announced over the intercom. Evelyn straightened her dress, grabbed her bag, and made her way to the consultation room. Dr. Clayton, a middle-aged man with a stern expression, barely glanced at her as she entered. He gestured for her to sit down, his demeanor cold and detached. "What seems to be the issue?" he asked, flipping through her medical records without meeting her gaze. Evelyn began to explain her symptoms, detailing the discomfort and pain she had been experiencing. As she spoke, Dr. Clayton's expression hardened. He cut her off mid-sentence. "Are you biologically male or female?" he asked, his tone devoid of empathy. Taken aback by the bluntness, Evelyn hesitated before responding. "I'm a transgender woman," she said, her voice tinged with defiance. Dr. Clayton's lips pressed into a thin line. "I see. Well, that complicates things. Our clinic is not equipped to handle cases like yours. You may need to seek care elsewhere." Evelyn felt her heart drop. "But I was referred here. I was told this clinic specializes in my condition." Dr. Clayton shook his head. "We can't help you here. You'll need to find a facility better suited to your needs." His words were laced with subtle disdain. Humiliated and angry, Evelyn left the clinic, tears threatening to spill as she stepped onto the crowded sidewalk. She had faced discrimination before, but this felt like a betrayal from an institution meant to uphold the Hippocratic Oath. Determined not to let this injustice slide, Evelyn began to document her experience, sharing it on social media. Her post quickly went viral, garnering support from friends, activists, and strangers alike. The hashtag #HealthcareForAll began trending, amplifying her voice and shedding light on the systemic discrimination faced by transgender individuals in healthcare. As the days passed, Evelyn's story reached the ears of Oprah Winfrey, the legendary talk show host and philanthropist known for championing social justice causes. Moved by Evelyn's courage and resilience, Oprah decided to take action. As Evelyn's post continued to gain traction online, the hashtag #HealthcareForAll became a rallying cry for people worldwide who shared similar stories of discrimination in healthcare. Comments poured in from transgender individuals, allies, and activists, sharing their experiences, anger, and unwavering support for Evelyn. News outlets picked up her story, and before long, it became a national conversation. Evelyn, however, was not accustomed to the limelight. She was overwhelmed by the outpouring of attention but also determined to use her platform to push for change. As she sat in her modest apartment one evening, her phone buzzed incessantly with notifications. Among the flood of messages, one name stood out, making her heart skip a beat. It was from Oprah Winfrey's team. The email was brief but powerful. Oprah herself had read Evelyn's story and was deeply moved. She wanted to meet Evelyn and discuss how they could address the systemic issues that allowed such blatant discrimination to persist. For a moment, Evelyn stared at the screen in disbelief. Was this real? She reread the email several times before responding, her hands trembling with a mix of excitement and nervousness. Within days, arrangements were made. Evelyn found herself on a plane to Chicago, where she would meet Oprah at her studio. As the flight landed and she stepped off the plane, Evelyn's nerves were palpable. But the thought of her story potentially sparking meaningful change gave her courage. At the studio, she was greeted warmly by Oprah's team, who guided her to a private lounge. Moments later, the iconic figure herself walked in, exuding warmth and charisma. Oprah extended her hand with a kind smile. "Evelyn, it's an honor to meet you. Your bravery has inspired so many," she said. Evelyn was momentarily starstruck but quickly gathered herself. "Thank you, Ms. Winfrey. I'm just trying to make sure what happened to me doesn't happen to anyone else." Oprah nodded, her expression serious. "And we're going to make sure of that." The conversation that followed was transformative. Oprah listened intently as Evelyn recounted her ordeal in vivid detail, from the receptionist's dismissiveness to Dr. Clayton's cold rejection. Evelyn also shared the emotional toll of such experiences, not just on her but on countless transgender individuals who face similar barriers daily. Oprah, known for her ability to connect deeply with people, was visibly moved. "Evelyn, your story is a wake-up call. It's unacceptable that anyone should be denied care simply because of who they are. We're going to shine a light on this issue and hold those responsible accountable." Over the next few days, Oprah and her team worked tirelessly with Evelyn to craft a plan of action. They decided to feature Evelyn's story on Oprah's network, dedicating an entire episode to the challenges faced by transgender individuals in the healthcare system. The episode would not only highlight Evelyn's experience but also include testimonials from medical professionals, activists, and others who had faced discrimination. The day of the taping arrived, and Evelyn found herself seated on Oprah's iconic set. The audience was a mix of allies, activists, and curious viewers who had been following the story. Oprah introduced Evelyn with her trademark eloquence, setting the tone for what would be a powerful and emotional conversation. As Evelyn shared her story, the audience listened in rapt silence. Her voice wavered at times, but Oprah's reassuring presence gave her the strength to continue. She spoke not just for herself but for every marginalized individual who had ever been denied dignity and respect in a medical setting. The episode also featured a panel of experts, including a transgender doctor who spoke passionately about the need for inclusivity in healthcare. "Discrimination in medicine is not just unethical, it's dangerous," the doctor said. "We must ensure that everyone, regardless of gender identity, has access to competent and compassionate care." The episode concluded with a surprise announcement. Oprah revealed that her foundation would be partnering with several organizations to launch an initiative aimed at training healthcare professionals in cultural competency and inclusivity. The initiative, named Care Without Bias, would also provide scholarships for aspiring transgender medical students. Evelyn was overwhelmed with emotion. What had started as a deeply painful experience had turned into a movement for change. As she hugged Oprah on stage, the audience erupted in applause, their faces reflecting hope and determination. Following the taping of Oprah's show, Evelyn's story continued to reverberate far beyond what she could have imagined. The #HealthcareForAll campaign gained unprecedented momentum, with millions of people sharing their own stories of discrimination and rallying behind Evelyn's call for change. Social media became a platform not just for outrage but also for education, as activists, medical professionals, and allies shared resources and advocated for systemic reforms. Meanwhile, Evelyn's appearance on Oprah's show did more than just spark conversation, it ignited action. Within days, several major media outlets picked up the story, broadcasting Evelyn's experience to a global audience. News anchors discussed the glaring inequities in the healthcare system, and talk show hosts invited experts to speak on the urgent need for reform. Evelyn's face was everywhere, on magazine covers, in online articles, and on television screens. Evelyn, however, remained grounded. While she was grateful for the attention her story was receiving, she knew that real change required more than just headlines. It required sustained effort, policy changes, and a collective commitment to inclusivity. Determined to keep the momentum going, she began working closely with organizations that had long been fighting for transgender rights in healthcare. One such organization, the National Center for Transgender Equality, reached out to Evelyn with a proposal. They wanted her to become a spokesperson for their new campaign, which aimed to push for federal legislation banning discrimination against transgender individuals in healthcare settings. Evelyn hesitated at first. She wasn't sure if she was ready for such a public role. But after reflecting on the countless messages she had received from people who saw her as a beacon of hope, she knew she couldn't turn down the opportunity. Evelyn threw herself into the work, traveling across the country to speak at rallies, conferences, and town hall meetings. Her speeches were raw and heartfelt, resonating deeply with audiences. She didn't just share her own story, she amplified the voices of others who had experienced similar injustices. Each time she spoke, she emphasized the same message: healthcare is a human right. No one should have to fight for dignity and care. One of the most powerful moments of her journey came during a meeting with lawmakers in Washington, D.C. Evelyn, accompanied by a group of activists and legal experts, sat across from a panel of senators tasked with reviewing the proposed legislation. She spoke with conviction, her voice steady despite the gravity of the moment. "I didn't ask to be a symbol," Evelyn began. "I didn't ask for the pain I endured when I was turned away from care. But now that I'm here, I refuse to let that pain be for nothing. I refuse to let the next transgender person who walks into a doctor's office face the same humiliation and rejection that I did." Her words were met with a standing ovation from those in attendance, and several senators pledged their support for the legislation. It was a small but significant victory, and Evelyn felt a renewed sense of hope. Meanwhile, the Care Without Bias initiative launched by Oprah's foundation was already making waves. Hospitals and medical schools across the country began adopting the program, which provided comprehensive training on cultural competency and inclusivity. Evelyn was invited to visit some of these training sessions, where she met with healthcare professionals eager to learn and do better. At one session, a young medical student approached Evelyn, tears in their eyes. "Because of you, I feel like I can make a difference," they said. "Thank you for showing the world what's possible." Evelyn was deeply moved. Moments like these reminded her why she had chosen to share her story, despite the vulnerability it required. She realized that change wasn't just happening on a systemic level, it was happening in individual hearts and minds. However, not everyone was supportive. Evelyn faced her share of backlash from detractors who resisted change or clung to prejudices. Online trolls targeted her with hateful comments, and there were even instances where she felt unsafe during her travels. But Evelyn refused to be intimidated. She leaned on her growing network of allies for strength and continued to focus on the positive impact she was making. One day, as she prepared for yet another speech, Evelyn received a phone call that left her speechless. It was Dr. Clayton, the very doctor who had refused to treat her. "I don't expect you to forgive me," he began, his voice shaky. "But I want you to know that your story opened my eyes. I've started attending the Care Without Bias training, and I'm doing everything I can to unlearn the prejudices I didn't even realize I had. I'm sorry for the pain I caused you." Evelyn was taken aback. She had never expected an apology from Dr. Clayton, let alone a genuine effort to change. While she couldn't forget what he had done, she appreciated his willingness to take responsibility and grow. "It's never too late to do the right thing," she told him. "I hope you continue to use your position to make a difference." As the months went by, Evelyn's life transformed in ways she could never have imagined. She became a sought-after speaker, a respected advocate, and a symbol of resilience and hope. But she remained humble, always reminding herself that her journey was about more than just her. It was about creating a world where no one had to endure what she did. The culmination of Evelyn's efforts came when the federal legislation she had fought so hard for was finally passed. The Transgender Healthcare Equity Act, as it was called, mandated that all healthcare providers receive training in cultural competency and prohibited discrimination based on gender identity. It was a historic moment, and Evelyn was invited to the signing ceremony at the White House. As she stood on the podium, looking out at the crowd of activists, lawmakers, and supporters who had made this victory possible, Evelyn felt a surge of pride and gratitude. "This is proof that change is possible," she said. "Together, we can create a world where everyone is treated with dignity and respect." The crowd erupted in applause, their faces reflecting the hope and determination that had fueled the movement. For Evelyn, it was a moment of closure and a reminder that even the darkest experiences could be a catalyst for light. Evelyn's life after the passing of the Transgender Healthcare Equity Act took on a new rhythm, one that was equal parts activism, mentorship, and personal growth. Though she was no longer in the thick of legislative battles, her work was far from over. She now focused on ensuring that the changes promised by the new law were implemented effectively, holding institutions accountable and supporting those on the ground who were working to make healthcare more inclusive. One of her primary initiatives was partnering with medical schools across the country. Evelyn became a guest lecturer, sharing her story and teaching future healthcare providers the importance of empathy, cultural competency, and advocacy. She created a curriculum based on real-world experiences, drawing from the stories of countless transgender individuals who had reached out to her over the past year. Her sessions were a mix of storytelling, practical guidance, and interactive exercises, designed to break down biases and build understanding. At one of her lectures, a young doctor in training raised his hand. "Ms. Johnson," he said, "how do we balance the need for professional boundaries with creating a space where patients feel truly seen and heard?" Evelyn smiled. "Great question," she replied. "Boundaries are important, but they shouldn't come at the expense of humanity. Sometimes, it's as simple as asking, 'What name and pronouns would you like me to use?' or saying, 'I see you, and I'm here to help.' Those small acts of respect can make a world of difference." Her words struck a chord with the students, many of whom approached her after the lecture to express their gratitude. Evelyn's ability to connect on a personal level, coupled with her unwavering determination, made her an effective and beloved educator. Meanwhile, Evelyn's advocacy extended beyond the classroom. She worked closely with hospitals, clinics, and community health centers to ensure that the Care Without Bias program was being implemented effectively. She conducted site visits, reviewed training materials, and provided feedback to administrators. Her presence was both a motivator and a reminder of why the work was so important. During one visit to a rural clinic, Evelyn met a nurse named Lisa who shared how the training had transformed her approach to patient care. "Before this program, I didn't realize how much my unconscious biases were affecting my interactions with patients," Lisa admitted. "Now, I feel more equipped to provide care that's respectful and affirming. Thank you for being the catalyst for this change." Evelyn was deeply moved. Stories like Lisa's reminded her that change was happening, even if it wasn't always visible. Each person who embraced inclusivity represented a step forward, and Evelyn was determined to celebrate those victories. However, the journey wasn't without its challenges. Despite the progress made, Evelyn often encountered resistance from individuals and institutions unwilling to change. Some healthcare providers refused to participate in the training programs, citing personal beliefs or claiming that the new requirements were unnecessary. Others implemented the programs superficially, going through the motions without a genuine commitment to change. Evelyn didn't shy away from these obstacles. Instead, she addressed them head-on, engaging in difficult conversations and advocating for stronger accountability measures. She also leaned on her growing network of allies, including medical professionals, legal experts, and activists, who helped amplify her voice and push for compliance. One particularly impactful moment came during a town hall meeting in a conservative community. Evelyn had been invited to speak about the importance of the Transgender Healthcare Equity Act, but she knew that not everyone in the audience would be receptive. As she began her presentation, she noticed a man in the front row shaking his head and muttering under his breath. When the Q&A session began, the man stood up. "Why should we have to change the way we've been doing things for decades just to accommodate a small group of people?" he demanded. "What about our rights?" Evelyn took a deep breath, meeting his gaze with calm resolve. "This isn't about taking away anyone's rights," she said. It's about ensuring that everyone has the opportunity to access healthcare without fear of discrimination or rejection. Imagine if it were your child, your sibling, or your best friend who was denied care simply because of who they are. Wouldn't you want to change the system for them? Her words seemed to resonate with the audience, and by the end of the session, even the man who had challenged her approached her to apologize. "I hadn't thought about it that way," he admitted. "Thank you for helping me see things differently." Evelyn's ability to connect with people, even those who initially opposed her, became one of her greatest strengths. She believed in the power of dialogue and education to break down barriers and build bridges. Meanwhile, Oprah continued to be a steadfast supporter of Evelyn's work. The two women remained in close contact, brainstorming ways to keep the momentum going and support other individuals fighting for justice and equality. Oprah's foundation provided funding for Evelyn's initiatives, and the two often appeared together at events and conferences. One day, Oprah surprised Evelyn with an unexpected honor. During a gala celebrating the success of the Care Without Bias program, Oprah presented Evelyn with the first ever advocacy award, recognizing her contributions to creating a more inclusive and equitable healthcare system. As Evelyn accepted the award, she reflected on how far she had come. "This journey has been one of pain, growth, and transformation," she said. "But it's also been one of hope. Together, we've proven that change is possible, and I'm excited to see what we can accomplish next." The audience erupted in applause, their faces filled with admiration and gratitude for Evelyn's courage and resilience. In the years that followed, Evelyn continued to be a driving force for change. She wrote a memoir detailing her experiences, which became a bestseller and inspired countless readers. She also established a foundation dedicated to supporting transgender individuals in accessing healthcare and navigating discrimination. Through it all, Evelyn remained grounded, never losing sight of the purpose that had fueled her journey. She knew that the fight for equality was far from over, but she also knew that progress was being made, one step, one conversation, and one victory at a time. Evelyn's memoir, Unbroken Threads: A Journey to Equality, became a cultural phenomenon. It was not just a recounting of her personal struggles but also a blueprint for advocacy and systemic change. The memoir opened with her harrowing experience at the clinic that had once refused her care and expanded to include the stories of countless others whose lives intersected with hers. Each chapter intertwined her journey with broader societal challenges, offering a deeply personal yet universal narrative. The success of the memoir brought Evelyn into new spheres of influence. She was invited to speak at international conferences, from the United Nations to grassroots assemblies in small towns. Her story resonated with people across borders and identities, creating a ripple effect of empathy and action. Activists in countries with even harsher healthcare systems reached out to Evelyn, seeking advice on initiating similar reforms. Despite her rising prominence, Evelyn stayed deeply connected to her community. She maintained an open-door policy at her foundation, personally meeting with individuals who sought her guidance. One of these individuals was Liam, a young transgender man who had been rejected by his family and was struggling to navigate the healthcare system. "I feel invisible," Liam admitted during their first meeting. "Everywhere I go, I'm either ignored or dismissed." Evelyn took his hand, her gaze steady and full of conviction. "You are not invisible, Liam," she said. "Your existence matters, and your voice is powerful. Let's work together to make sure the world sees you for who you are." With Evelyn's mentorship, Liam not only gained access to the care he needed but also found his own voice as an advocate. He went on to lead workshops on transgender healthcare in rural areas, becoming a beacon of hope for others facing similar challenges. Evelyn often referred to Liam as one of her greatest successes, though Liam would argue that it was Evelyn's unwavering belief in him that made all the difference. Meanwhile, Evelyn's foundation expanded its reach, launching initiatives that addressed systemic inequities beyond healthcare. They partnered with schools to incorporate LGBTQ+ education into curriculums, ensuring that future generations grew up with a deeper understanding of diversity and inclusion. They also worked with corporations to create safer and more equitable workplaces, providing training programs that emphasize the importance of representation and respect. One of the foundation's most ambitious projects was the establishment of a national hotline for transgender individuals in crisis. Staffed by trained counselors and healthcare professionals, the hotline offered a lifeline for those in need, providing everything from emotional support to guidance on accessing medical care. The initiative was a resounding success, with thousands of people reaching out within its first year. As the years passed, Evelyn's impact continued to grow. She received numerous accolades, including a Presidential Medal of Freedom, and her work inspired a wave of new advocates who carried the torch forward. Yet, Evelyn remained humble, often deflecting praise by highlighting the collective effort behind every victory. In one of her interviews, a journalist asked, "What keeps you going, Evelyn? After all you've accomplished, what drives you to keep fighting?" Evelyn smiled, her eyes shining with determination. "The people I meet," she replied. "Every story of resilience, every act of courage, every step toward justice. It's all fuel for the fight. As long as there's work to be done, I'll be here, doing my part." True to her word, Evelyn continued to dedicate herself to the cause, her legacy woven into the very fabric of the movement she helped create. Her name became synonymous with hope and perseverance, a reminder that even in the face of adversity, change was possible. Evelyn's advocacy entered a new chapter when she decided to focus on empowering younger generations. She believed that the key to sustaining progress was to inspire and equip the next wave of leaders. To this end, she launched the Evelyn Initiative for Equality and Empowerment, a program dedicated to mentoring LGBTQ+ youth and fostering their leadership potential. The initiative held its first leadership summit in a packed auditorium, with over 500 young attendees from across the country. Evelyn took the stage to a standing ovation, her presence commanding yet approachable. She began her keynote speech by sharing a simple truth: every voice in this room has the power to change the world. Her words resonated deeply with the audience. Among them was Maya, a 16-year-old transgender girl who had traveled 1,200 miles with her mother to attend the summit. Maya had endured relentless bullying in her small hometown and often felt like her dreams of becoming an artist were unattainable. Meeting Evelyn changed that. After the keynote, Maya nervously approached Evelyn with a portfolio of her artwork. Evelyn flipped through the pages, her expression one of awe and admiration. "Maya," she said, "your talent is extraordinary. The world needs to see what you create." Evelyn personally connected Maya with a network of LGBTQ+ artists and gallery owners. Within a year, Maya's art was showcased in a prominent gallery, and she became a voice for young queer artists navigating the challenges of self-expression. Her journey inspired others to pursue their passions despite societal pressures, and Maya often credited Evelyn for helping her believe in herself. As the initiative grew, Evelyn expanded its reach to include scholarships for LGBTQ+ students pursuing higher education. These scholarships provided not only financial support but also mentorship opportunities, ensuring that recipients had the guidance and resources needed to thrive. Evelyn often met with the scholarship winners, listening to their stories and encouraging them to dream big. One of the most notable recipients was Adrian, a non-binary student studying medicine. Adrian had faced significant obstacles, including being disowned by their family after coming out. Despite the hardships, they were determined to become a doctor specializing in transgender healthcare, inspired by Evelyn's story. During a panel discussion at the initiative's second summit, Adrian spoke about their journey. "I wouldn't be here today without Evelyn's support," they said, their voice steady but emotional. "She reminded me that my identity is my strength, not my weakness." Evelyn beamed with pride as she listened from the front row. Adrian's story was a testament to the transformative power of compassion and advocacy, a reminder of why she had dedicated her life to this work. Beyond the initiative, Evelyn's influence continued to shape public discourse. Her memoir was adapted into a critically acclaimed documentary, Unstoppable: The Evelyn Taylor Story, which premiered at major film festivals and reached millions worldwide. The documentary featured interviews with individuals whose lives Evelyn had touched, from healthcare professionals to grassroots activists. One particularly poignant segment showcased a nurse who had worked at the clinic that initially refused Evelyn care. The nurse tearfully recounted how Evelyn's courage had inspired her to challenge the discriminatory practices within the healthcare system. "She taught me that silence is complicity," the nurse said. "Because of Evelyn, I found the strength to speak up." As Evelyn watched the documentary premiere from the audience, she was moved to tears. It was a surreal experience to see her life's work laid bare on the screen, a mosaic of struggles and triumphs. Yet, she knew that the story was far from over. There was still so much more to do. Evelyn's resolve only deepened when she was approached by international organizations seeking her expertise. She began collaborating with global NGOs to address healthcare inequities in developing countries, traveling to regions where access to care was even more limited. Her visits often made headlines, her presence a symbol of hope for marginalized communities. During one such trip to a rural village, Evelyn met Amina, a transgender woman who had been ostracized by her community and denied medical care. Despite the adversity, Amina had become a leader, creating a support network for others facing similar challenges. Evelyn was struck by Amina's resilience and immediately offered her foundation's resources to support the network's growth. Months later, Amina's organization had expanded to neighboring villages, providing not only healthcare access but also educational workshops aimed at fostering acceptance. Evelyn and Amina stayed in touch, their partnership a powerful example of what could be achieved when advocates united. Evelyn's work continued to inspire new legislation aimed at protecting LGBTQ+ rights. She frequently testified before Congress, her eloquence and expertise leaving a lasting impression on lawmakers. One of her most significant victories was the passage of the Transgender Health Equity Act, which mandated comprehensive healthcare coverage for transgender individuals nationwide. Standing beside the president at the bill's signing ceremony, Evelyn reflected on the journey that had brought her here. She thought of the clinic that had turned her away, the protests that had galvanized a movement, and the countless lives that had intersected with hers along the way. As the cameras flashed, Evelyn turned to the crowd and said, "This is not the end of the fight. It's just the beginning. Together, we will continue to build a world where everyone has the dignity and respect they deserve." Evelyn's impact on the world grew exponentially as the years passed, transforming her from a local advocate into an international symbol of resilience and hope. Her foundation expanded its reach globally, partnering with organizations in over 30 countries to address healthcare inequities and promote LGBTQ+ rights. Each partnership brought new challenges, but Evelyn faced them with unwavering determination. One of the foundation's most ambitious projects was the Global Health Access Initiative, aimed at building inclusive healthcare facilities in underserved areas. The first of these centers opened in a remote village in South America, where access to medical care had been virtually non-existent. Evelyn personally attended the inauguration, cutting the ribbon amidst cheers from the local community. During the visit, Evelyn met Javier, a young transgender man who had been living in secrecy due to fear of persecution. Javier shared his story with Evelyn, describing how he had avoided seeking medical care for years, even when he needed it most. Now, with the new center, Javier finally felt safe enough to access healthcare. "This center isn't just a building," Javier told Evelyn, his voice trembling with emotion. "It's a lifeline. It's hope." Hearing stories like Javier's reaffirmed Evelyn's commitment to her mission. She worked tirelessly to ensure that the centers not only provided medical care but also fostered a culture of acceptance and understanding. Each center employed local healthcare professionals trained in LGBTQ+ inclusivity, creating safe spaces for individuals who had long been marginalized. Meanwhile, Evelyn continued to use her platform to amplify voices that often went unheard. She hosted town halls, gave speeches at international conferences, and frequently appeared on television to discuss pressing issues. Her words carried weight, not just because of her accomplishments, but because of her authenticity and vulnerability. During one particularly memorable interview, Evelyn was asked about the challenges she faced as a transgender woman in the public eye. She paused for a moment, then said, "Every challenge I've faced has been a reminder of why this work is so important. If my struggles can pave the way for someone else to have an easier journey, then every hardship has been worth it." The interview went viral, resonating with millions around the world. People from all walks of life reached out to Evelyn, sharing their own stories of resilience and gratitude. Among them was a young doctor named Priya from India, who had been inspired by Evelyn to start her own LGBTQ+ health clinic in her hometown. Evelyn immediately reached out to Priya, offering mentorship and funding through her foundation. The clinic quickly became a beacon of hope in the region, providing life-saving care to hundreds of patients. Priya often credited Evelyn for giving her the courage to take that first step. "You didn't just inspire me," Priya wrote in a heartfelt letter. "You believed in me when I doubted myself. That belief changed everything." As Evelyn's influence grew, so did the scope of her foundation's work. She launched a scholarship program for LGBTQ+ students pursuing careers in medicine, ensuring that the next generation of healthcare providers would be equipped to address the unique needs of their communities. The program received thousands of applications in its first year, a testament to the hunger for change. One of the scholarship recipients, Malik, became a shining example of the program's impact. A gay man from a conservative background, Malik had always dreamed of becoming a surgeon but faced constant barriers due to his identity. With the scholarship, Malik was able to attend medical school, where he excelled academically and became a leader in advocating for inclusive healthcare practices. At the Foundation's annual gala, Malik took the stage to share his journey. "Evelyn's belief in me gave me the strength to believe in myself," he said, his voice steady but emotional. "Now, I'm not just pursuing my dream, I'm building a future where others can pursue theirs without fear." The gala was one of Evelyn's proudest moments. Surrounded by supporters and allies, she reflected on how far the movement had come and how many lives had been transformed along the way. Yet, she knew there was still much work to be done. Evelyn's next endeavor was perhaps her most ambitious yet, a global summit on LGBTQ+ healthcare, bringing together leaders, activists, and professionals from around the world. The summit aims to create a unified action plan for addressing healthcare disparities and promoting equality on a global scale. The event was a monumental success, with over 10,000 attendees and countless partnerships formed. Evelyn's closing speech was met with thunderous applause, her words echoing the summit's theme. "Together, we are stronger. Together, we can build a world where no one is left behind." The summit marked a turning point in Evelyn's journey. No longer just a trailblazer, she had become a unifying force, bringing people together to create lasting change. Her vision of a more inclusive world was no longer just a dream, it was a reality in the making. Evelyn's journey reached its apex in the most unexpected way, a personal request from Oprah herself. One morning, as Evelyn sat in her modest office, reviewing plans for the next summit of the Evelyn Initiative, her phone rang. On the other end of the line was Oprah's assistant, relaying a message that Oprah wanted Evelyn as the keynote speaker for her Global Visionaries of Tomorrow event. The event, held in a grand auditorium in Chicago, would bring together leaders, changemakers, and influencers from around the world. Evelyn's story, Oprah believed, was a perfect representation of resilience and the power of individual impact. Evelyn felt honored but nervous. This would be her largest audience yet, with millions watching both in person and online. The day of the event arrived, and Evelyn stepped onto the stage in a striking blue suit, a subtle nod to the dress she wore the day her life changed forever. The applause was thunderous, and as she stood before the sea of faces, Evelyn took a deep breath, grounding herself in the moment. "I'm not here because of a single act of courage," she began, her voice calm yet commanding. "I'm here because of every person who refused to give up on this fight. I'm here because people like you decided that compassion, empathy, and justice were worth fighting for." She shared her story, weaving in anecdotes about Maya, Adrian, Amina, and countless others whose lives had intersected with hers. She spoke about the power of advocacy and the ripple effect of standing up for what's right. Her words brought the audience to tears, laughter, and moments of profound reflection. The highlight of her speech came when she revealed a personal dream she'd kept close to her heart, a dream of building an international LGBTQ+ healthcare network that would provide free medical care to those in need, regardless of their location or circumstances. "Healthcare," she said, her voice unwavering, "is not a privilege. It is a human right." The announcement was met with a standing ovation, and Oprah herself walked onto the stage, embracing Evelyn. Together, they pledged to raise the funds needed to make this dream a reality. The image of the two women standing side by side became a symbol of hope and a call to action for people worldwide. In the months that followed, the healthcare network, dubbed Evelyn's Haven, became a reality. Clinics opened in underserved areas, staffed by professionals trained in providing compassionate, inclusive care. Evelyn's leadership brought together governments, private donors, and grassroots organizations, creating a model that was both sustainable and transformative. Evelyn's work didn't just change the lives of those who visited the clinics, it inspired systemic change. Medical schools began incorporating LGBTQ+ healthcare training into their curriculums. Governments passed anti-discrimination laws that protected access to medical care. And most importantly, individuals began to see themselves not as victims of a broken system but as agents of change. Despite her global recognition, Evelyn remained grounded. She often visited clinics, sitting with patients and listening to their stories. She continued to mentor young leaders, reminding them that progress was not a straight path but a series of small, interconnected victories. Her legacy was cemented not through statues or awards but through the lives she touched. Evelyn's name became synonymous with hope, justice, and the belief that one person's determination could indeed change the world. As Evelyn looked back on her journey, she often marveled at how a single act of discrimination had set her on this path. What began as a fight for her dignity had grown into a movement that redefined the future of healthcare and equality. Her story was a reminder to the world: adversity is not the end, it's the beginning of something extraordinary. And for Evelyn Taylor, that extraordinary journey was far from over.